Okay, Shelby doing oral medication administration on Jane Smith. I'm going to use my hand sanitizer. I'm going to come into the patient's room and I'm going to do all my pre-steps. I'm going to verify that it's the correct patient. Can you state your date of birth, Mrs. Smith? And I'm going to check her wristband. I'm going to check it against her Cardex and her MAR to make sure everything matches up, the name, the numbers, the birth date. And that's going to be my first check. I'm coming in to do your medication administration, and so I'm just going to make sure I do some double checks. And I'm already going to have asked about any allergies. I know by looking at her Cardex that she has no known drug allergies. So I know that she's got cardiovascular or coronary artery disease, bronchitis, a history of hypertension, depression, arrhythmias, and she's a 2-pack per day smoker. And I'm going to now go ahead and look, and I'm here to deliver, or I'm here to do the 12 o'clock and the 1200 and the 1300 meds on Mrs. Smith. And so the first med that I would be giving would be digoxin, 0.125 milligrams by mouth daily at 1300. And I'm going to explain first I'm going to go and look at all my medications on my MAR. I'm going to double check them against the Cardex and make sure everything is exactly the same, that it's all written down exactly the same, the right dosage, the right route, the right patient, the right amount, the right time. I'm going to make sure all those 5 rights are exactly written on here correctly. So I have all my stuff written down, and I do have it all on here. Okay, the first thing that I'm going to do is look at all that. I'm going to verify it against my physician's orders also. The first thing that I'm going to notice, well, I'm going to go get all my medications out of the Pyxis. So I'm going to grab my medications, and I'm not going to open anything up yet, and I'm going to have take it all with me. What I'm noticing when I'm looking at all this stuff is that I need to call a physician because there is no route determined in the physician's orders or on the Cardex or on the MAR for the amoxicillin. It doesn't tell me if it's by mouth, if it's intravenous, if it's intramuscular. So I need to call and get that verified how I'm going to be giving that medication. So I can't do anything with that till I hear back from the physician. But in the meantime, I can go ahead and my digoxin, I can get it all, make sure it's all the right dosages. My Coumadin, 5 milligrams by mouth daily at 1300. So while I'm usually these would be given at different times, I'm here to do the 1200 and the 1300. So I'm just going to state them both right now. And I'm going to make sure everything else is okay here. On the KCL that I'm going to be giving, because that is a 12 o'clock med, you can go and verify everything with your Davis Drug Guide or another hospital formulary list. And in looking at that, it's supposed to be 40 to 80 milligram or milliequivalents per day. But if it's an adult patient, because the patient was supposed to get 8 milliequivalents by mouth 3 times a day, so that's 24 milliequivalents. And to treat hypokalemia, it's 20 to 40 milliequivalents per day. And so I'm assuming that the physician did that dosage. And then I'm also going to be giving the amoxicillin, but I'm waiting to hear back from the physician on that. So I'm going to get all my medicines ready because I've done 3 checks now. I've done 2 checks, checking through everything and verifying it. So now I'm going to go ahead and verify once more with the wristband and make sure everything is correct. My medicine is going to be put into the little cup without me touching it. I'm just going to pop it into there, and I'm going to give it to the patient either in their hand, or give them the cup so that they can take the medicine. I'm not going to touch the medicine, and I'm going to make sure that I see them take it and swallow it. I'm going to have a big glass of water, which I neglected to get out here, but the digoxin and the Coumadin, I believe, or no, the digoxin and the KCL, the potassium, they both need to be taken with a full glass of water. And so I'm going to make sure I state, for the patient that is what they need to do with both of those medications. I'll let the patient know on each medication, the digoxin. I'm going to also have with the digoxin and the potassium, I'm going to have another nurse check my dosages. And another thing I forgot to state before, if I notice that any of the dosages are off on here with the supply dose that I have, I'm going to go back and do the calculations before I come in to give the medications and make sure that I've got my calculations all right. And then I'm going to come in and I'm going to let them know, what each medicine is for. Your digoxin, as I'm looking at all this, all her stuff on her Cardex and in her MAR and in the physician orders, letting the patient know exactly what each drug is for when I give it to them. The digoxin, the Coumadin, which is an anticoagulant, and the potassium, which is a treatment for potassium depletion. Her digoxin is for arrhythmias, heart arrhythmias, so it's for her heart. And so I'm going to let her know on each of those. Make sure if she says, this pill doesn't look like one that I've ever taken before, I am not going to give that medication. I'm going to go back and I'm going to double check what I've picked out, because if the patient has never seen it before, I want to make sure I'm not giving the wrong medication to the patient. And so right after the patient has taken, I've watched her take every one of her medications, I'm going to go on my MAR, and under the shift verification, I'm going to sign that I gave those medications, and if they took them with a full glass of water. None of my pills needed to be split. I needed to find out on the amoxicillin what route I was supposed to give that. The other thing I would want to tell the patient is, like with the potassium chloride, the KCL, you're going to want to avoid a lot of I think it's vitamin A foods. Want to avoid them because you're going to want to, that's going to mess with the effectiveness of the medication. And some of those foods are, I had looked them up so I could make sure I told my patient. Oh, actually, I'm sorry, it's the Coumadin. You're going to limit the vitamin K, and it's asparagus, beans, broccoli, cauliflower, milk, yogurt, cabbage, those kinds of foods. I'm going to check too when I'm giving these medications, because some of them are going to have, look for different interactions between the two, or between any of the medications. And I'm also going to be watching to see if it should be given with meals or not with meals, and any lab tests. The digoxin for my patient here needs to be, she needs to have, any lab tests that they need to have. I'm going to also need to look for like edema to see if they're retaining any fluids. Listen with my stethoscope for any crackles or rails in the lungs. With the Coumadin, I'm going to need to monitor the prothrombin time and the INR. So those are going to be things that we need to do before. And also tell her that she needs to use a soft toothbrush, and not to irritate the gums or to have any activities that could make her start bleeding. And then there will be stool tests with that one also. The potassium, a serum potassium will need to be drawn before and then periodically during the therapy. And your renal function, serum bicarbonate, and pH will need to also be monitored. Okay, so the next, and then I'm going to document all of that, and that's like my third. I've done 3 checks to make sure all the meds are right. I'm going to document that the meds were all given at the time, and then I'm going to leave the patient in comfort after. Now I'm going to go on and do the eye medications. I'm also going to have asked, after each medication how they were feeling, if there's any changes, make sure all the vital signs have been checked too. So now I'm going to do the eye drops, or actually I'll do the ear drops first. The physician's orders in here, when I checked it, says that they need 2 drops instilled in their right ear twice a day. So I'm coming on to do the first dosage of drops. And so I'm going to have the patient turn into the left side lying position, and I'm going to explain, I'm going to be doing these drops, and I want you to just lay on your side for 5 to 10 minutes after, just so that the medication can get into your ear. And I'm going to examine their ear, ask if there's any hearing difficulties or if they've been having any problems, and then I'm going to inspect, and if there's any crust or cerumen in the ear that I can see, really carefully, I'm going to take that out. And then I'm going to be holding a tissue in my hand. I'm going to pull the pinna up and back for an adult, and I'm going to pull it down and back for a child. I'm going to hold it about 1/2 inch over and instill the 2 drops. And then I'm going to have gloves on, of course, when I've done this. And then I'm going to be rubbing the tragus to try to distribute that medicine. Okay. Now if you could just keep laying on your side so that medicine can be in there. And if the physician, wants you to place some cotton in the ear, then you could take some, pull it apart if it's too much. Never pack it in there tightly, just gently lay it in there inside the ear, and come back and assess after 5 to 10 minutes and ask how the patient's feeling again, if there's any, how it feels after the eardrops have been instilled, and then document all your findings after. Now for the eye drops, of course I'm going to put my gloves on, done all my pre-steps, all of that stuff again, but this just happens to be that this lady needs eardrops and eye drops, and so I'm going to come in and I'm going to examine the eyes. If there's any crusting, I'm going to take a wet washcloth and I'm going to wipe from the inner canthus to the outer canthus, and I'm going to always use a different portion of my washcloth if there's a lot, and I'm going to do it for both eyes, from the inner to the outer. I'm going to have explained the procedure, asked if there's any allergies. I'm going to have checked in the physician's orders to make sure this is what the doctor wants instilled. He wants 2 drops instilled in the right eye. And so I'm going to, with my dominant hand, hold my eye drops, take the cover off, place it down, hold a tissue in the other hand, and pull down on the eye, put my other hand up on the forehead, and hold it about 1/2 inch to 3/4 inch above, and place 2 drops. And then I'm going to ask the patient to close their eye real gently, and then I'm going to just hold the tissue on the bottom part, on the canthus part, and then I'm going to let them, just ask them, how that feels after that, and document any of my findings, and then make sure the patient's placed back in comfort.